I'm Mariz LABONETE from BSN Level 2-4, and for today's video, I will be showing with you on how to assess a pregnant woman's abdomen called LEOPOLD'S maneuver. LEOPOLD'S maneuver is a common and systematic way to determine the position of a fetus inside the woman's uterus. And LEOPOLD'S maneuver is important because it helps to determine the presentation, lie, and position of the fetus, which in conjunction with a correct assessment of the shape of a maternal pelvis can indicate whether the delivery is going to be complicated, normal, or whether a cesarean section is necessary. Prior to the conduct of the procedure, I will review the patient's previous medical records if available. This is done to avoid instances of harm to the patient, to know her medical history and current treatment procedure, and provide privacy to the patient by closing the curtain. Then introduce yourself and confirm the identity of the patient. Hello and good day, ma'am. I'm Mariz LABONETE, your student nurse for today from Our Lady of Fatima University. So for verification, ma'am, may I ask your name and your birth date?
Good day, ma'am. My name is Rachel Ann Suarez. Birthday, November 12, 1990.
Okay, so how would you like me to address you?
You can call me Rachel.
Okay, Ma'am Rachel, I'm glad to see you here and allow me to explain the procedure that we will be doing for today.
Okay, ma'am.
So our procedure for today, ma'am, is called the LEOPOLD'S maneuver. It means it has 4 maneuver or grids. This is important for us to determine the fetal position, presentation, and lie of the baby inside your womb. And I will place my hand into your abdomen and I gently palpate it. So all the results will be documented, but it will be kept confidentially. So is that okay with you, ma'am?
Yes, it's okay.
Okay, thank you so much, ma'am. Great. If the patient agreed, you can continue the procedure. So before we start our assessment, ma'am, would you like to use the bathroom first and empty your bladder, ma'am, so that there will be no discomfort once we start our assessment?
No, I can't.
For the next one, do the proper hand washing to avoid any cross-contamination of microorganisms. Next, place the patient on a dorsal recumbent position, supine with knee slightly flexed. And drape her properly to maintain patient privacy. And expose the abdomen, only the necessary area for the procedure. Then warm hands by rubbing together before placing them over the mother abdomen to gain comfort. Cold hands may stimulate uterine contractions. Now, let's come to the first maneuver called the fundal grip. Face the mother using both hands to palpate the upper abdomen, feel for the fetal part lying in the fundus. The fetal head is more firm, hard, and round that moves independently of the body. The breech is less well-defined that moves only in conjunction with the body. The second maneuver is called the umbilical grip. Move the hands down toward the pelvis and palpate the abdomen. One hand is used to steady the uterus on one side of the abdomen, while the other hand moves slightly on a circular motion from top to the lower segment of the uterus. Use gentle but deep pressure. The fetal back is smooth, hard, and resistant surface. The knees and elbows of fetus fill with a number of angular nodulation. For the third maneuver is called Pollick's grip. Place one hand just above the symphysis. Using thumb and finger, grasp the lower portion of the abdomen above symphysis pubis. Press in slightly and make gentle movements from side to side. This is to determine engagement of presenting part. For the fourth or last maneuver called the pelvic grip. Facing the woman's feet, place both hands from the lower part of the abdomen, then move down to the side of the uterus towards the pubis. This is to determine the degree of fixation of the fetal head. Once you're done with the assessment, put down the patient's dress and ask about the procedure if she has concerns, questions, or any discomforts. And after performing the LEOPOLD'S maneuver, don't forget to wash your hands to prevent contamination. Also, don't forget to validate patient feelings or any more concern about the procedure. And lastly, document everything that I did and the findings I found about the mother. Okay, ma'am, we're already done. Thank you so much for your cooperation. It became quick and easy assessment.
Thank you also.